Good evening, class.
Good evening.
So, welcome to today's lesson. Let me see who is in and who has not attended the class. This is my Faith Wanyana, John Wanyana, present. Isaac Bit, Pauline Evelyn Wanga, Anna Udo,
Present.
Eunice Njoroge. Yeah. So, in our last class, who can remind us of what we discussed about? Yes, Pauline.
Definition of the term pharmacology.
Yes,
The study
we
of
define.
drugs.
True, if I define pharmacology. Anyone else? Yes, Ruth?
The branches of pharmacology,
Yes, which are?
pharmacodynamics and pharmacokinetics.
Pharmacodynamics and pharmacokinetics. So, that is what we did in our last lesson. So, we went on pharmacokinetics and pharmacodynamics as branches of pharmacology. So, in today's lesson, we are going to learn in pharmacokinetics. And that is our lesson, our topic for today's lesson. So our learning objectives are to define pharmacokinetics and explain the ADME process. Is that fine? For those who are writing down, define pharmacokinetics and explain ADME process. So when is today? 30th of June. What do you remember about the 30th of June?
You can remember the salary place, the salaries leave. Will that disappear?
So as I encouraged you last time, let's put our spiritual abilities into work. Seek excellence in everything we do and revise periodically. Is that fine? Yes. So, pharmacokinetics. I want us to define pharmacokinetics, and you can look at your internet, those who have the connection, and tell us what is pharmacokinetics. Definition of pharmacokinetics. Yes, Eunice?
I can define pharmacokinetics as the branch of pharmacology that studies what the body does to a drug when it is administered.
Yes, good. That is very good. So you have said pharmacokinetics is a branch. Is that right?
Yes.
So it's a branch of pharmacology. It does what?
It studies what the body does to a drug
Sure.
after it is administered.
Are we together?
Yes.
Yes. So it studies what the body does to the drug. This is the correct definition of pharmacokinetics. So it's a branch of pharmacology. It studies what the body does to the drug. Yeah? Yes. So our learning outcome number one. Correct. Done. So we are going to explain the four admin processes in pharmacokinetics. So with me here, I have a chart. And this chart we're going to use it to explain the admin processes. Is that fine? Yes. Isaac, can you come here? So thank you, Isaac. So we are going to look at the admin process, and we are going to explain it using our chart here. So to begin, this admin, this is an acronym. It stands for so the acronym are admin. So this acronym stands for absorption. It stands for absorption. B. This stands for distribution. This stands for distribution. Then M. M stands for metabolism. M stands for metabolism. We have E. E stands for excretion. Say excretion.
Excretion.
So when we are done with all of these, absorption, distribution, metabolism, excretion, we will be able to have understood what pharmacokinetics is. And we said pharmacokinetics is what the drug, what the body, your body now, does to the drug, from absorption to excretion. So this is what happens when we take drugs. For instance, we have paracetamol, which is called acetaminophen, which is normally called Panadol. You know that? Have you ever used Panadol? Yes? Yes. So, for most of us who have taken medicine, the Panadol tablets, or we said in our last class, we said there are different routes of different ways of administration of drugs. We said there is oral administration, and we also talked about injections. Is that fine? Intravenous and oral. So for absorption, we are going to focus on how these drugs are being absorbed. So when we talk of absorption, this is where you introduce the drug into your mouth. Then it is absorbed into the bloodstream. Is that right? So absorption is when the drug enters into the bloodstream. Do you see this bit? Do you see this bit here? Yes. So this is where you focus on. So the drug enters bloodstream. Is that right? So you have taken your drug, let's say Panadol. You have taken it orally through your mouth. So what happens? It goes down through your esophagus. Yeah? Yes. It goes down through your esophagus. It goes into the stomach. Into the stomach, it is churned. It is mixed with food or the stomach components, such as the HCl, hydrochloric acid, and it is then taken into the small intestines. From the small intestines, it is absorbed. Absorption takes place in the small intestines. Is that fine? From there, we have the hepatic portal vein. The hepatic portal vein takes it from moves it from the small intestine to the liver. So in the liver, what happens in the liver is metabolism. And what is metabolism? Here, this is the liver. Is that fine? So this is the liver. So here in the liver, the drug is chemically altered into forms that are easier to eliminate or to be taken into the systemic circulation. Is that fine? Yes. Yes. So that we have talked about absorption, metabolism. Then it enters the systemic circulation to the specific organs and tissues. Is that fine? Yes. To the intended purpose, for the intended purpose. So that is distribution. So what happens in distribution? So the drug now moves from the bloodstream to the body tissues, maybe the lungs, the heart, the muscles, and your brain. Is that fine? Upon moving to that areas, they do their intended purpose. Then, for the remnants, they are excreted. And how are they excreted? They are excreted through the kidneys. We have the kidneys, the two being shaped. You can see from the diagram. Then it can be excreted from the liver via bile or through the lungs when you expire the air. Is that fine? So this is the whole process that happens when you take drug orally. So the ADME. So number one, ADME, I told you, it's for absorption. Number two, distribution. Number four, metabolism. Number five, excretion. Is that fine? Yes. That's good. So, any question up to this point? Any question? There being no question, who can tell us what we have learned today? Yes? Yes, sir.
The admin process of pharmacokinetics.
We have learned on the admin process of pharmacokinetics. And what is admin? John, A stands for absorption. Abigail, D stands for distribution. Give metabolism. M stands for metabolism. Yeah. So that is what we have done today. So there being no question, I'm leaving you with a follow-up activity. So you are expected to explain the ADME process. So you do this you do this assignment, and it will be due on date 2. That is in our next class. Yes? Yes. Have a blessed day.
Yes.